Hey, good afternoon, everyone. This is Mike Venanzi with VisualDx. I'm the clinical account director for the East region. Thank you so much for joining us today. Joining me today is Dr. Azeen Sadeghian from Baton Rouge, Louisiana. She's a practicing dermatologist. Dr. Sadeghian, you want to say hello?
Hey, everybody. Thank you all for dropping in.
All right. While we're waiting for a few more folks to join in, there are already some folks in the Zoom call. Feel free to enter in any questions through the chat. Everyone is muted except for myself and Azeen, but we'll address any questions that you have towards the latter half of the presentation. So feel free to just enter those into the chat box. I also have a colleague of mine who will be monitoring those. And we will certainly address them towards the end. But we're going to get started. And I'm going to first start off by introducing VisualDx on the web. I know there are some folks on the call who are actually current users of VisualDx, as well as some interested clinicians out there and students who are also interested in exploring VisualDx as a potential resource, both academically and clinically. I want to point out a couple different things on the web before I jump into the demonstration part of the presentation. The first is that we are really keeping a close eye on the current crisis with COVID-19. On the left-hand side of the screen, you'll notice some links linking out to the CDC as well as the World Health Organization, as well as the European Union link as well with the most up-to-date information surrounding COVID-19. I also want to highlight our COVID-19 page. This is something that we're updating on almost a daily basis at this point, with recent news coming out every 12 to 24 hours. You'll find on this specific page a great synopsis, background information, even billing codes, best tests, how to manage it, therapy options. But you'll find as we go through the demonstration that one of the things that VisualDx is well known for is our image collection. And this is something that we've been collecting since the start. You'll see some great imagery of chest x-rays. And then towards the bottom half of the images, you'll even start to get into the dermatological components that clinicians are now seeing with COVID-19, specifically COVID toes. And all of these images are coming from trusted resources, prestigious institutions, really highlighting not just a strong quality images, but also some great descriptions behind them. A couple other things I want to point out when it comes to the homepage of VisualDx, not just accessible on the open web. You can also get access on your mobile device, both Android and Apple. You can do so by clicking this link right here, by getting the mobile app. If you're part of an institution, you can create your own username and password. Download the app in the App Store, and then see all of the content as well as the images right on your personal device. And then for those that are interested in gaining CME credit, you're actually gaining half a CME credit as you continue to utilize VisualDx.
So I also just want to add, speaking to the COVID situation, COVID is such a new thing, and we're getting new information about it all the time. And one of the things as a clinician is you may not personally see, a dozen or so cases of COVID, yet you are expected to be able to diagnose and triage and best manage a patient who comes in with something, even if you're not very familiar with it from a personal experience. So one of the beauties of relying on a resource like this is it's enhancing and broadening and strengthening your knowledge base by augmenting your knowledge. So you're not relying on just your own personal experiences, but you're relying on a accumulation of evidence and information from a variety of different medical sources. And so it's really augmenting your intelligence in that capacity as well. And so this is updated frequently. And as you know, COVID is the information just keeps changing so quickly. And so this allows you to kind of stay on top of everything.
Great. Thanks for that comment, Azeen. Moving along in the demonstration part of VisualDx, we're going to start to give you some really great examples on how to utilize VisualDx in the non-clinical setting as well as the clinical setting. So 2 approaches to VisualDx. You have the backward thinking approach where you've got the diagnosis in mind and you just want to confirm it. You can search really any diagnosis that's out there. We have over 3,100 and growing on a monthly, annual basis. And you can do that just by typing it in right into the search bar. So, for example, if I have a patient that I know has shingles, for example, I could just jump right to it. One of the great things about this is you can also adjust the patient from an adult, child, and even to an infant if it's applicable. And that also adjusts the content as well as the images that you're seeing on this specific page. What you're going to get with VisualDx is you're going to get right to the point. It's really intended to be utilized at the point of care. And what I mean by that is you're going to get a quick synopsis, really written in paragraph form. You're going to have your billing codes, things to look for. You've got some nice diagnostic pearls. We have a nice textbook diagnosis and pitfall section right here. We get a lot of use out of this. And then as you continue, you're going to get best tests, how to manage it, as well as therapy options. And then finally, you're going to get some nice drug reaction data. These citations, which are linked under each medication that's listed, if you click the number that's associated with that medication, you can link directly out to the publication so that you can see the citations which are linking this specific medication to the diagnosis page. But what makes VisualDx really world-renowned, as I mentioned before, is our image collection. And it's been our mission for now over 20 years to not just collect the classic presentation. We want to show you variation of disease. And what I mean by that is showing different skin pigmentations, different levels of severity, different body locations. And from a patient engagement standpoint, and I know Azeen will talk more towards this throughout the demonstration, is that you can really enhance that engagement with the patient that much better with a tool like VisualDx. So if you're speaking to a patient of color, you can easily adjust the skin pigmentation and show them what shingles looks like in a patient of color just by easily adjusting any one of the skin types throughout the Fitzpatrick scale.
Yeah, so I found this tool to be very helpful, particularly in the era of WebMD and things like that. A lot of times patients will come in and they think they have a diagnosis, and you strongly believe they have another diagnosis based off of your clinical experience. And you're able to show the patient these images, and it instantly builds that confidence in what you are diagnosing them with. So that's been really helpful, because a lot of times they'll look at those images and that looks just like what I have. And you're like, yes, and that is what I'm diagnosing you with. And so that's been very helpful.
Great. Thanks so much, Azeen. And then one final note on each page, we've got more of a common diagnoses that are out there. We've got a great patient handout section as well. This is written in a middle school to high school reading level, a nice time saver for a lot of clinicians if they're looking for an easy way to pass along information surrounding the diagnosis that's just been made. You can easily print this off. You can email to them. It's also written in Spanish and in English.
And I'd like to add, with the drug reaction data that Mike previously touched on, the reason why that's so important is in the era of polypharmacy, our patients are on sometimes over 5 to 10 medications, if not more. And medications can cause side effects and adverse outcomes. And there have been cases where patients have drug-induced psoriasis, or the reason for the zoster, some medications such as antimetabolites can predispose a patient to getting that diagnosis. And so I think it's very prudent in the era of polypharmacy to be able to take a step back and say, is this really a primary disease or is this a secondary disease? And so that quick resource allows you to do that in a very time-sensitive manner.
Great, thanks, Azeen. I'm going to move along to the other approach to VisualDx, which is the forward-thinking approach. And what I mean by that is many times clinicians are left with uncertainty as to what type of diagnosis it is, but the patient's presenting with a chief complaint. And VisualDx has a great guided workup approach for our students, our clinicians, to utilize VisualDx to not only be familiar with the right questions to ask, but to create a thorough differential so that after you've entered in all the findings, you can take really a closer look at all the possibilities that are out there, which are associated with the findings that the patient is presenting with. So I'll give you a couple of examples of that. The first is you can approach this by typing in the chief complaint within the search bar here, or you can start off with a differential builder that we've created. And I want to highlight that VisualDx is not just in dermatology. You can use this really across any specialty in medicine. So I'll start off with a patient who may have abdominal pain. So I can easily go click this, select abdominal pain as the chief complaint. And then this is the guided workup approach where you can continue to add findings based on the chief complaint to ultimately create that differential. So a couple things going on right here. Number one is the chief complaint is entered in on the right-hand side around the findings, but you can also adjust the patient's age as well as the gender at birth on the right-hand side. So where is the abdominal pain? Is it in the right, lower, upper quadrant area of the abdomen? We can say that it's in the right upper quadrant. Any GI symptoms, any nausea, vomiting, diarrhea, any physical GI signs. We'll say that they have hypoactive bowel sounds. You don't need to type in, you don't need to select each of these questions, but these are really there to guide you as a student and as a clinician to ensure that you're asking the right questions. The onset findings, we'll just say that it's developed acutely. You get the point. You can continue to move forward. Once you feel comfortable as a clinician that you've found all the appropriate findings associated with the patient, you can then select View Differential. And when you select View Differential, we categorize it in 5 different sections. The first is Consider First, which are the most common. And this is really where the misdiagnosis happens often. Right? Looking at the variation of the common. And as you scroll over each of these diagnoses that are listed, you can see which of the findings are matching up to the diagnosis. And these are all weighted findings as well. So as you look at acute pancreatitis at the top, you're seeing 6 of 6. But as you go to the very bottom, let's say down here, you're seeing 4 of 6 matches. And then once you feel comfortable, you can select the diagnosis and view the full article. But I want to touch on the other ones as well. You can see Consider Second, which is rare, emergencies, anything life-threatening is highlighted in red, infectious diseases, drug-induced, or you can view them all.
Yeah, so the differential builder is extremely helpful. And I want to highlight a few ways that I've personally used the differential builder and how it's been paramount in my development as a physician. One of the ways I first came in use of this was during residency. And during residency, obviously, you can clearly see how this is helpful. You have a consult in the middle of the night. You need to have a broad differential, and you need to be able to narrow your differential before you even sign out to your attending. And you need to be able to compare all your differentials and argue why you think it's case A versus a diagnosis A versus diagnosis B, and make your case that way. That's in residency. I definitely want to highlight how it's very important for me to use even now. So as a clinician now, how I use it is it helps me prevent premature closure. And what that means is sometimes as physicians, we get a little bit confident and we make an error called the premature closure, where we've seen 100 cases of, let's say, viral gastroenteritis, and then somebody comes in and we're like, oh, the same symptoms, it's just the viral bug going around. This is what you have. And it's reasonable to think that, but what if you're actually missing the acute pancreatitis or something that's more life-threatening or dangerous? And so being able to keep your differential broad is very important. In some ways that I've used this has been in very difficult cases, meaning a case that you're stumped and you need to be able to broaden your differential. You can use this to help broaden it quickly. And the thing of this is not replacing your clinical acumen in any way. You know what all these diagnoses mean. You've learned about these, but you need to bring them to the forefront of your conscience so you can be able to rapidly go through them and be like, no, it's not that, it's not that, it's not that. In some cases, as you know, sometimes we get a mental block. You may have had a sleep deprived evening, or you've been under a lot of stressors, distractions in a day, and you kind of get a mental block and you can't quickly broaden your differential. This is sometimes more quick than just sitting and trying to rapidly pull it out of your brain. And then also I like to use a differential builder. If I see a patient, I've diagnosed something and we've treated it and they're still not getting better. In that case, you need to take a step back. Was I wrong? Could this have been something else? And you can build out your differential and try to make sure you're not leaving any stones unturned.
Great. And just to highlight again, the chief complaint really creates the guided workup for you. So if you were to select dermatology, for example, and say that the chief complaint is multiple skin lesions, you would then come up with a guided workup that looks completely different. The chief complaint creates that guided workup, so they're not the same across the board. I also want to highlight that you can always enter anything into the additional findings that is outside the barriers of the guided workup. So if the patient comes in with a blanching macule and they just got back from, let's say, Haiti, and the location of the skin finding is widespread, the signs and symptoms will say that there's some itch and some fever, we can view the differential from there. And then because I've typed in Haiti as one of the findings associated with the patient, it'll automatically jump to the infectious disease tab. And you can see that Zika virus, chikungunya, dengue fever are some of the ones that come up top. And then those that are not applicable to the diagnosis, those findings that are not applicable, I should say, are also crossed off. So you can see under dengue fever that itch is not associated with dengue fever, but you can see chikungunya as well as Zika virus. All 6 are matching up. One final example I want to show you on the web is creating a differential based on a medication that the patient is taking and a chief complaint that is associated with that. So if the patient comes in and they're saying that ever since I've been taking, let's say, naproxen, they've been having a rash, and we'll make the patient in their 50s, and we want to say, are there any citations linking naproxen to any form of dermatological issue, more specifically a rash? So we can view that differential, and it'll automatically go through the drug-induced tab. And then in the lower right corner of each diagnosis box, you'll see a pill or a tablet. And each of those, you'll see a number associated with that, and that represents a number of citations of naproxen linking to that diagnosis. You can easily click this. It'll jump right to the actual references. You can go right into the full article by selecting that, and then you can go right to the drug reaction data and see all the other medications as well that are associated with this diagnosis listed in alphabetical or numeric order.
Yes, and one of the things that I like to think about whenever we kind of looked the drug up, and you could see that beautiful layout of all the different things that you need to consider, is sometimes there's an elephant in the room, and it has nothing to do with the diagnosis. And what I mean by that is sometimes we think it's the drug and it's not the drug, or vice versa. We think it's the disease and it's actually drug. And so in that previous screen where you could see all the different tabs, like consider first, second, third, emergency, and drug, that's what I like about that is, yes, you are considering drug, but at the same time, you need to be able to step back and say, hey, let me look at the emergencies and make sure it's not something else. What if it has nothing to do with the naproxen? So what I like about it is this is serving as your safety net, because we know sometimes patients, we can only go off of what the patients tell us, and that's dictated by, are we asking the right questions? And sometimes we only ask the right questions based off of what the patient tells us. And so this is really important. They may have been like, I started naproxen a week ago, but not tell us that maybe something else also, they have an associated symptom that makes it not naproxen. And so this is really beautiful to keep your differential broad and keep your patient very safe.
Yeah, and to add to that, we are all humans, and one thing that humans do best is pattern matching. And if your patient is presenting with a rash such as the one you're seeing right here, you can start to look at these confirmed cases with the patient and really give yourself confidence as well as the patient confidence that you're making the right diagnosis, and you can really utilize VisualDx as a tool to really do that pattern matching. So I'm going to pause right here and shift over to my iPhone where we'll demonstrate the DermExpert feature. I'm going to shift the screen over and you'll see my iPhone right now. I do want to point out that all of the content as well as the images that you're seeing are also available on your mobile device. And just give me one moment here. Okay, great. Back on board here. If I want to highlight the DermExpert feature, which is an AI feature that is an add-on feature to VisualDx. You can see the camera in the top right corner of the VisualDx app. When I select that camera, this is HIPAA compliant, and how you would utilize this is by taking a picture of a skin lesion with a patient. It'll analyze the morphology of that image coupled with some additional data that you'll be entering in through questions such as how long the patient has had it, any fever associated with it, age, gender, things like that to ultimately create a differential. And we've got some confirmed cases that physicians have sent us, which are true success stories of the DermExpert feature within VisualDx. So here's an example of a young African-American patient who is presented with this dermatological issue in the armpit region. So when you use DermExpert, you could analyze the photo, and within seconds, what's happening in the background is it's analyzing the morphology of that image. And there are 81 different skin lesion types in the background. And you can see the confidence level from green, in some cases it's orange, all the way down to red. This is not necessarily the right answer. It's using your judgment as a clinician, as Azeen had said before. This isn't going to give you the answers. You're still using your clinical background to determine the best course of action moving forward. We're just utilizing this as a secondary opinion. So it's coming up as a sinus skin lesion type. You can adjust the patient's age as well as gender. And then you can select whether this is a single lesion, limited in the area, or widespread. So we'll say it's limited in the area. I'll click the arm, and then specifically I'll select the axilla, and then hit next. There was no itch associated with this. No fever was present. And this has been happening chronically for just about a month now. So, and the patient is well otherwise. So when we create the differential, what's going to happen is similar to the web. You're going to have a weighted finding differential that's built in, and you're seeing consider first. And as you saw on the web, you could just do as humans do best, which is pattern match. And you can see the green to the yellow all the way down to the red at the very bottom. But as you select the images, you can continue to scroll through with the patient in a room and start to see similar images of this diagnosis to help bring more confidence in understanding these skin lesion types, as well as making the right decision when it comes to the diagnosis. And then, just like you saw on the web, you're seeing a quick synopsis, billing codes, how to treat it. You've got your patient handout all included right on the mobile device.
So I'd like to add to the artificial intelligence. I think that is a term that people polarize to, and so how I think of it is artificial intelligence is definitely a huge asset and a tool, because I think the fear is that, is it replacing your clinical judgment? And it's not, it's just strengthening it. So it's kind of like carrying a textbook at your side. A textbook is not replacing you, you're using it as a tool. And so what this is able to do is just like say, hey, these are kind of what's matching up, and this is what you should consider. And so what this really is augmenting your intelligence and your capabilities and strengthening that. And so that's one way you can view it. I'd also like to share how this is, and maybe I should touch to this later, Mike, but about how VisualDx and even DermExpert can help with your workflow.
Sure, you can go ahead and touch on that. I want to be respectful of everyone's time as well.
Okay, yeah, so I'll just get to that really quickly. How I use VisualDx in my workflow, and you're busy, you have to see multiple patients, so is usually I use it mostly as a rapid reference. And so you can see your treatment options, your billing codes, and things like that. You can establish patient trust by reviewing the images with the patient, and that takes no time from your cell phone. And then also the handout that Mike taught us about, you can send that from your phone or from the desktop, and it's not sent from your personal email address, but it's sent from VisualDx. You can even have it translated to Spanish. So all of those things really help speed up your workflow. It's a lot quicker than digging for a handout in the old filing cabinets like we used to do. So.
Yeah, and just to add to that, it is HIPAA compliant. The images go through a cloud. Once the image is taken through the app, it's gone. We never see the photo, nor does the clinician have the opportunity to save the photo. And then just to touch on Azeen's last point with the patient handouts, that also goes to the cloud, where you can simply type in the patient's email address within the VisualDx application. That then is automatically sent to the patient's email address. But again, VisualDx does not see the patient's email address. It is just an automatic patient information guide that's sent to them directly through the cloud. So again, I want to be respectful for everyone's time. If there are any questions, certainly enter them into the chat box. Happy to address them. While we're waiting for any questions to come in, I do want to point out that VisualDx is used all over the world. Individually, we have thousands of subscribers, but institutionally, we also have thousands of partners out there throughout the world. The benefits from an institutional standpoint are far greater than individual subscriptions. We're able to integrate into electronic medical records. We're also the only external partner of UpToDate, which is a great benefit for institutions to use both resources hand in hand to enhance their workflow. IP authenticated, really customizable to any institution out there as a means to enhance patient care as well as to reduce physician burnout and to enhance the overall workflow for those clinicians within the institution. Still waiting on questions to come in, but one thing I do want to point out again is that VisualDx is not just dermatology. You saw that with our COVID-19 page. Another great thing that we're working on is the orthopedic side. So I'll show you a great page, calcium pyrophosphate deposition diseases. One page which really highlights the work that we've been putting in really across all of medicine. And right here you're seeing the orthopedic side with great descriptions of these x-rays, as well as great content as well. So not just dermatology. Okay, well, we don't have any questions coming in to the chat, but we have recorded this and we will be sharing this. If you do have any questions at all, I do want to put my contact information up on the screen here. We certainly appreciate the opportunity to join us for the afternoon. If you have any questions at all, please feel free to reach out at any point. thank you again for the opportunity, and thank you, Azeen, for joining us. We really do appreciate it.
Thanks, Mike, and thank you everybody for your time.